There are many different diagnoses for a patient with impaired skin integrity or risk for impaired skin integrity. For example, patients can be at risk for infection, patients can have risk for imbalanced nutrition less than body requirements, or ineffective peripheral tissue perfusion. Nurses should consider the nature of the wound and the cause of the problems related to the wound to identify areas for interventions and implications for potential recovery. Nurses should write goals and outcomes specific to the patient's needs. Interventions for patients at risk for pressure ulcer development or impaired skin integrity include topical skin care and incontinence management, protecting bony prominences, using skin barriers, repositioning patients every 1 to 2 hours as needed, altering support surfaces, and decreasing the amount of pressure exerted over bony prominences. When changing a patient's position off of a bony prominence, nurses should attempt to meet a 30-degree lateral rotation to avoid other pressure points. Nurses should attempt to take a holistic approach to wound management. Nurses should work in conjunction with dietitians and wound care nurses, as well as pharmacists, to help meet the patient's needs. An individualized care plan should be developed for each patient and take into account the patient's age, nutrition, presence of medical conditions, and other contributing factors. A wound will not move through the phases of wound healing if infection is present. The nurse should prevent wound infection by cleaning the wound and removing non-viable tissue. Mechanical debridement includes wound irrigation. Chemical debridement uses topolytic enzymes to induce changes in the tissue and break down necrotic tissue. Surgical debridement is the removal of tissue by the use of a scalpel, scissors, or other sharp instruments. A moist environment helps support the movement of epithelial cells and facilitates wound closure. The nurse will need to impress on the patient and the patient's family the importance of nutrition, fluids, and body positioning to prevent further deterioration of the wounds. Patients with pressure ulcers who are underweight or losing weight need enhanced caloric protein supplementation. A patient can lose as much as 50 grams of protein per day from an open weeping pressure ulcer. A low hemoglobin level decreases delivery of oxygen to the tissues and leads to further ischemia. When possible, nurses should help maintain a hemoglobin level at least 12. For surgical wounds that heal by primary intention, it's common to remove dressings as soon as drainage stops. In contrast, when dressing a wound that is healing by secondary intention, the dressing material becomes a means for providing moisture to the wound or assisting in debridement. The dressing technique varies depending on the goal of the treatment plan for the individual wound. If the goal is to maintain a moist environment, for a clean granulation wound, it's important not to let the saline moistened gauze dry and stick to it. In direct contrast, if the goal is to mechanically debride the wound, then the wound should be used as a wet to dry dressing where the contact dressing debrides necrotic tissue and the dry dressing is allowed to stick to the wound in order to facilitate wound debridement. Other purposes of dressings are to protect the wound from microorganisms, aid in hemostasis, support or splint the wound site, protect the patient from seeing the wound, and promote thermal insulation of wound surfaces. The use of dressings requires an understanding of the wound healing and factors that influence wound healing. A variety of dressing materials are available to the nurse, and different dressing techniques will be practiced in the skills lab. For example, dried dressings are used to help facilitate wound debridement and prevent contamination of microorganisms. Film dressings occlude the wound but allow the surface of the wound to still breathe. Hydrocolloid dressings protect the wound from surface contamination. Hydrogel maintains a moist surface to support healing. Wound vacs assist in negative pressure to support wound healing and facilitate extractions being removed from the wound bed. Packing a wound helps facilitate wound healing and also helps remove extra secretions from the wound bed. Before placing a dressing on an ulcer, the nurse should know the pressure ulcer stage and do a thorough assessment, understand the goal of treatment, mechanism of action of the dressing, and all the principles of wound care. Nursing interventions for reducing and treating pressure ulcers are needed to determine whether the patient has met the identified goals or outcome. If the patient is unable to meet the intended goal or outcome, the nurse should ask questions to identify what areas were not met and revise the nursing care plan as appropriate.